welcome back to my YouTube channel. It is Nicole, the Glam Teacher. Today's video, I am going to give you a detailed breakdown of the cost of surgery in the Dominican Republic. People think that surgery is so much cheaper in the DR. It is a little bit, but the cost can really add up. A lot of women and guys, they get their quote and say, wow, $5,000 for surgery, and that's it. No, no. That is not it. It can get quite costly, and your post-op care will be expensive when you come back here. Getting those massages are not cheap here, okay? Especially when in DR, they're about $20 to $30. When you come back here, you could be paying $100 per massage. So my list of things for surgery comes out to $9,370. Okay, so you might as well say 10K right there. And then if you happen to come back from DR and you have money left over, use that money towards your massages. Do not take the cheap way out and think, I'm not going to have complications, everything is going to be fine, my doctor said this is the cost, so this is how much I'm bringing. Be prepared for anything. Hope and pray for the best, but be prepared for anything to happen. If you don't have the money, you're not going to get it. I have heard stories of girls needing blood transfusions and they did not get it because they did not have the money for it. And they were just weak and down and however else you feeling when you need blood and you don't have it. So make sure you're prepared, ladies and guys. So starting out, you have your basic quote. And let's say for tummy tuck, muscle repair, lipo, you're going to get lipo in your armpits, your full back, your side, love handles. They're going to repair your muscles, abdominal muscles, your tummy tuck, and BBL. Now, BBL is optional. So you don't have to get the BBL, but it is not going to change the price. Okay? All right. So your quote is $5,600. Then you pay your deposit, and let's say your deposit is $300. So now you have $5,300 that you owe to the doctor. Also in that quote, make sure your quote is detailed and you get everything in writing. That way there's no confusion of what that quote includes, what you did and did not receive. So that quote includes 10 days in the recovery house, 5 massages, transportation to and from the airport, 1 post-op visit to your doctor. You might need to go to the doctor more. You might need to go see your doctor for something else. That extra trip is going to cost. It's not included in this quote. If you need to go to the pharmacy or the grocery store, you're going to have to pay a taxi driver, a Uber, whoever, because it's not in your quote and it's not free. So your labs, most of your pre-op labs are going to be included in that quote, your first garment, and your night in the clinic. But did you hear me when I said most of your labs are going to be included? Yes. There are some things that you might have to pay outside of that. Say your EKG wasn't right and they want to just do a further testing to make sure they're not missing anything. Now remember, they're very detailed in testing and making sure your body is in the right condition for surgery. So if your EKG did not go correct, they're going to do further testing with a specialist, and that's going to be an additional fee. Okay? Then we have supplies. You're going to need to bring supplies because all recovery houses do not supply everything. You need to make sure and check with your recovery house and see what they supply and how much they supply. They might say, oh, we supply chucks or gauze and tape for your incisions, but they're only changing your incision every other day when you might prefer to get it changed every day. Therefore, that will require more gauze, tape, and medical supplies, and the recovery house may not do it. You may need to bring chucks. Your recovery house says they supply chucks, but they only supply 1 a day. You might be leaking out all over the place, and who wants to sit in their leaky bodily bloody fluids? No, that's not good. That's running you a risk at getting an infection. When your chuck is soiled, it needs to be changed. So if the recovery house is not providing enough chucks, you need to have your own supplies or extra money so you can get more chucks. Then there are other extra costs. $150 for your second stage faja. $150 for post-op meds. That may be a little lower because you might bring your own antibiotics or your own iron and vitamins, your own creams. Or it could be higher because you had aggressive lipo and got like a little burn, and so you need more cream. Those post-op meds are also your heparin shot. Your heparin shot that you'll need to get up to like 7 days after surgery each day. $300 for blood transfusion, and that is refundable. You may get that back if you do not need blood. If you are a smoker or have asthma, there's an extra $100 fee for testing, $150 complication insurance. Now, everyone doesn't have to pay, and it depends on the doctor, okay? For most of the doctors that I have researched, because my BMI is higher than 32, I have to have this complication insurance. Some doctors don't require it. And that insurance covers you for things that are like the doctor's fault. If the doctor, let's say, was a little too aggressive and they're taking action for, like, yes, I was at fault, then they will send you to the oxygen chamber and it'll be covered under that. But if it's not the doctor's fault and that's something that you want to do just to heal faster and heal better, and you want to do the oxygen chamber treatments, then that is an additional, I put $400 because each treatment is about $100. Some recovery houses have it and they offer it at maybe $75, or because you are staying at the recovery house, they'll give you a discount to use their oxygen chamber. Make sure you get whatever that price is in writing with the recovery house, so when you get there, things are not changing and you have proof to back it up that, hey, you told me that I could get this treatment for $65. Why now are you charging me $100? Ask questions, get it in writing, and be clear. Okay, this is your money, this is your life. Your overnight nurse is going to be $100, and that's for 12 hours. There is a $120 fee for Doppler, and that's to check for blood clots. There is, I put down $250 for additional massages because you're going to need those massages. They are critical in your recovery, helping to get that swelling and additional fluids off of your body. Remember, this quote that I'm going off of for an example only includes 5 massages, and that's just not enough, okay? How I'm looking at this, for me, it's not enough. So let's say I need an additional 10 more massages and they're $25, but they can be from $20 to $35, let's say. But at $25, then that's $250. Also, this quote is for a tummy tuck, and it's recommended that you stay in the DR for about 12 to 14 days. I think you need to stay a little longer, at minimum 16 days, especially if when you get back home, you're not going to have much help. So you will need to pay for extra days at the recovery house or Airbnb, but I haven't researched Airbnb much and I'm not interested in that option. So do not ask me because I do not know. But additional days in the recovery house, you'll need about 6 more days, and the average price for a recovery house is about $60 to $85. I put here $75. So 6 additional days by 75 is an extra $450. We talked about the oxygen chamber. Tips. I put $200 for tips. Please, y'all, don't go over there having these people do audit. Yes, they're doing their job, but these people are literally your lifeline. They are feeding you, wiping your butt, cleaning up after you, giving you your medicines on time. I believe you should tip. It doesn't have to be $20 a day, but if a person is doing their job plus going out of their way to make sure you're comfortable and safe, they deserve a tip. Even if they're not, going out of their way, but they're doing their job and making sure you're good, give them a tip, because they don't have to do this. They could be somewhere else. So be thankful that you do have those people in the recovery house there for you. Your driver looking out for you, making sure you're safe, things like that. Tip these people. They don't make a lot of money. And I know we're not rich, okay? That's another thing. I've heard stories where the nurses hear that this person is a good tipper. So when the nurses are leaving for the day, they're coming to the room I'm leaving for the day. You got tip, No, and you don't have to tip throughout your trip. I am going to wait until the end of my trip and then leave tips and a little thank you card for all the people that, took the extra time to help care for me. So that right there is $8,370. And then I added $1,000 for extra fees, just in case money. So that can be transportation, extra labs that you may need. That could be more supplies, food. Your drain might need to get replaced. It might get clogged up and you might need a new drain. And a new drain is $25. Bet y'all didn't know that. So yeah, be prepared with $1,000 extra for something that might happen. And another thing, your flight. Did I put flight on here? No, I did not put flight on here. So, yes, I did. So your flight, let's say $600. I am going to fly comfort there and first class back. You want to be comfortable on your way back, have that extra leg room because you're going to deal with some swelling. And just be comfortable, give yourself that extra space on the airplane. Also now, there is a COVID testing fee. And depending on the doctor, that COVID testing, I've heard some doctors are charging $300. $300. Now, the doctors that I've looked at, their fee is between $50 to $100 for the COVID testing. Depending when you're going, that price may change. But be prepared. I hope this helps out somebody. Please go ahead and like this video if you like it. Subscribe, please. And drop a comment. Let me know if this helped you, if you plan on getting surgery, if you want to learn some other tips, let me know what topics you want to hear and I will get that video out for you all. So go ahead and take care. Bye.